So I am back with another one of my favorites. Anybody that knows me well knows how much I love the foot and ankle. So today we're going to look at selecting proper shoes. This is especially for shoes such as your sneakers, your running shoes and all of that. We're also going to learn how to tie your shoes properly according to your foot posture. But first of all, let's look at foot posture assessment. So for foot posture assessment, we are going to use the foot posture index. So we're going to assess for a supinated foot, a pronated foot, or neutral foot, in between. So let's get started. The foot posture index. This is a tool used to rate foot posture using 6 set criteria. It was developed at the University of Leeds in the UK. Observations are made with the subject relaxed, barefoot, and in a double limb support position. It's used to assess for a neutral, supinated, or pronated foot. Criteria. There are 6 criteria considered. Number 1, talar head palpation. Number 2, curves above and below the lateral malleolus. Number 3, calcaneal inversion or eversion. Number 4, prominence of the region of the talonavicular joint. Number 5, congruence of the medial longitudinal arch. And number 6, abduction or adduction of the forefoot on the rear foot, also known as the 2 mini toe sign. The procedure. Ask the patient to march on one spot for a few seconds in order to relax them. The patient should remain standing in the same position throughout the assessment without adjusting their feet. The assessment should be done in an area with enough space for the examiner to move around the patient in order to assess all the aspects required. Number 1, palpation of the talar head. This is palpated on the medial and lateral sides of the ankle. In a neutral foot, the talar head will be equally palpated on both the medial and lateral sides. In a pronated foot, the talar head is more palpable medially, and in a supinated foot, it is more palpable laterally. Number 2, observe the curves above and below the lateral malleolus on both sides. If the foot is neutral, the curves should be approximately equal. If it is pronated, the curve below the lateral malleolus will be more concave, and if supinated, it will be more convex. Number 3, inversion and eversion of the calcaneus is observed from the posterior aspect. Imagine a vertical line along the long axis of the foot. Eversion means you're observing a shift of at least 5 degrees or more away from this line, and it represents pronation. And the opposite represents inversion, which means the foot is supinated. A straight line represents neutral. Number 4, bulging of the talonavicular joint. If it is prominent, it means the head of the talus is adducted and the foot is pronated. If this area appears concave, then the foot is supinated. If neutral, the area is usually flat. Number 5, congruence of the medial longitudinal arch. Here, we consider both the height and the shape of the medial longitudinal arch. If neutral, the curve and height are well defined. If the foot is pronated, the arch is flat, and if supinated, it is high. Number 6, abduction and adduction of the forefoot on the rear foot. This is viewed posteriorly. In a neutral foot, you can see both the medial and lateral sides of the forefoot equally. If supinated, the forefoot adducts and results in more toes being seen on the medial side, and pronation causes forefoot abduction, so there will be more toes visible on the lateral side. The final scores are tallied according to the degree of deviation. Selecting the proper shoe. Always remember to select a shoe that fits you well, not too tight and not too loose. Number 1. The shoes should sit flat and should not be angled to one side or to the other. Number 2. When you rock the shoe forwards and backwards, it should not tilt medially or laterally. Number 3. It should also rock equally forwards and backwards in a smooth manner. Number 4. To assess toe balance, tilt the tip of the shoe with your index finger. The shoe should balance forward without tilting. Number 5. To assess landing, allow the shoe to fall back to the table. It should fall flat and not tilt medially or laterally. Number 6. Bend the shoe to check if it bends equally without any sharp points. Number 7. Twist the shoe to both sides to see if it rotates equally on both sides. How to tie your shoes properly. Number 1. Insert the lace all the way up to the second last hole. Number 2. Make rabbit ears by inserting the lace from the second last hole to the last hole on the same side, and do this on both sides. Next, feed the lace through the opposite rabbit ear. If the foot is neutral, tighten the lace in the center. If the foot is supinated, tighten the lace by pulling it towards the medial side to provide a lateral support. For pronated feet, tighten the lace more laterally to provide a medial support. So guys, just remember, knowing your foot type can help you make better decisions when it comes to shoe selection, as well as how to tie your shoes properly. You'll also be able to understand what kind of shoes to avoid. Also, if you happen to have a certain foot type, or you're prone to having a certain foot type that's deviated from the normal, prevention is always better than cure. I'm saying this because most of the times problems within the foot usually give rise to problems in other joints, such as the knees, the hips, even your back. So I'm just gonna repeat this: prevention is always better than cure. Get to know your foot type, get to know what kind of shoes to avoid and how to tie your shoes properly. So I hope this video was helpful to somebody out there. If you like this video, please give it a thumbs up. And if you're watching this channel for the first time, I'd urge you to subscribe. Please subscribe. Subscribe, like, share, comment, ask your friends of friends. What did I just say? Yeah, okay, just do those nice things. And I'll catch you guys in the next video. Bye.